So now I'd like to talk to you about the neti pot or the nasal sinus irrigation. And I particularly like this one. Some people have like a teapot or a little genie pot, and most people don't like to do it. But the neti pot or the nasal sinus wash can help you with a lot of different things. And I use the neti pot for anything that where you have postnasal drip, if you feel something caught in your throat you can't swallow down, if you have sinus pressure, if your ears are full, if your eyes constantly have mucus in them or are dry, because all of those structures, your ear, your eyes, and your throat, are all connected to your nose. So if you fix your nose or treat your nose to teach it to work its normal nasal physiology, then all of those areas will improve, even if you weren't expecting them to improve. So I see a lot of people who have chronic clearing of throat or their ears feel full or plugged. So I'll have you do the neti pot, and I like you to do this one. And the reason why is because we have little cilia, which are hairs inside our nose. And the cilia move like this to move mucus that we produce. We produce 1.5 liters of mucus, snot, in our nose every day. So we have to take the cilia and move that mucus down our throat, and then we swallow it and we don't even notice it as long as your nose is functioning correctly. So if you've ever been in the ocean is salt water. You come out of the ocean and your skin is so dry. It just sucks the fluid that's in your cells out, and then your skin looks really dry. That's the same idea with the neti pot. It is salt water that you're putting in your nose. So if your cells are swollen with all the mucus that you have and your little cilia are trying to move the little hairs, it's not going to move the mucus because the cells are swollen over the hairs. So you put the nasal sinus wash in your nose, that's salt water. The salt water draws the fluid out of the cells shrink, and then your little hairs can work to move the mucus down the back of your throat. And then your ears, your eyes, your nose, and your throat all work and feel much better. I have many people who finally do the neti pot for me, and they're like, boy, I wish I would have done that 5 years ago. So the idea behind that is to keep your nose working its normal physiology, and it's not like you have to do it every day. You only have to do it every day in the beginning. So I give you a typed out worksheet, which you should have while you're watching this, and I want you to use it every day for a month. And then you can go to every other day for 2 weeks, and then you can do maintenance. So what I mean by maintenance is just once or twice a week. Now you can do the nasal irrigation every day if you want. You can do it 2 times, 3 times a day if you want. But once you teach your nose how to work properly, then you just need to do it once or twice a week. For example, I just use mine every Sunday night, like clockwork. I always do it. I have not had a cold or been sick since December of 2014. I did not get COVID. I haven't had RSV. And I always do it Sunday night, and then I do it if I go out and I mow the lawn, I come back in and I do it. If I am around, if I have a pediatric clinic and I'm around a lot of little kids who always carry germs, I come home and I do it. If I live on a farm, so if I go home and help my dad harvest soybeans, I come back in and I do it, and I get that bean dust out of my nose. If you go to a bonfire, if you're painting a room at home, all of those things you want to clean out your nose afterwards. But I always do it Sunday night like clockwork. And that just keeps your nose working its normal physiology. The other thing is I have so many patients who come into me and they are on Singulair, Flonase, Zyrtec, Allegra. They're taking all these medications and nasal sprays. And I'm like, that's a lot of money. You're purchasing those over the counter or maybe with prescription. And I just want you to quit all of that and just do the nasal sinus irrigation. And the thing to do is to bend over the sink 90 degrees. There's a little hole in the top of this little 8-ounce bottle. That's it. and you put the hole in your nose and you bend over the sink 90 degrees and you squeeze it just once, but a good squeeze so that half the bottle goes up into your nose. And when you do it, the key thing is to sing ah. So go ah and squeeze once, and then put it in the other nostril, ah, and squeeze again. And when you sing ah, the dangly thing in the back of your throat goes up to close off your nose, and the water will stay in your nose and it'll go up one side and come out the other. And it won't go down your throat and gag you, which is what people usually don't like about doing the nasal sinus rinse. So if you sing ah, then you will be an expert at it. And I even have kids do it. I have kids down to actually 3 years old who do it. So this will just help your overall ear, nose, and throat health. And it's amazing. Like I said, most people are just shocked by how they feel after they started using it. And the last thing I always mention to people is that if you ever come to see me, to see Dr. Ettema, she's going to give you a neti pot if you tell her your big toe hurts.